This is a Rogue Media Network podcast. This is Central Texas Life with Ann Harder.
Hello, everybody. Welcome back to the show, and it is wonderful to have Dr. Michelle Manning back again. It's been about a year.
Yeah, I think it's been about that long.
Since we visited, and it was sort of at the kickoff of Complete Women's Care.
Mm-hmm.
And so I thought, well, why don't we just check in with the good doctor and find out,
Sounds great.
how things are going.
Yeah. Complete Women's Care is an OB-GYN practice here in Waco. And we sort of branched off and did complete wellness care because we wanted the things that we were bringing in to be available to men and women. And men don't like to come to something called Complete Women's Care. Sounds
Well, I guess
a little
that's
girly
true,
to them. So for our wellness care right now, we're focusing on core and pelvic floor strengthening and support. It helps with treatments for urinary leakage. It helps with really some pelvic pain. We're seeing some real improvement with that where it's been due to some musculature.
Okay, it's a chair.
Yep.
And it's electromagnetic kind of
Right. So we
pulses.
have the Emsella chair, as seen on the Drew Barrymore show. And it is a large chair. I think it looks a little bit like a big toilet. Or a space captain's chair, one of the two.
Space Captain, I was probably
a little
more.
fancier.
I
A little fancier.
I was thinking more in those lines.
And you sit on it fully clothed, and there's electromagnetic pulses that come from the base of the chair in a particular pattern to strengthen the pelvic floor muscles and kind of lift them up. After you've had a couple of kids, if you've had some pelvic surgeries of certain kinds, you can get some weakness down there. You can get some muscle spasms. So there's lots of different reasons for that.
Hence the pain.
Right,
Yeah.
exactly. And really even when you have muscles that aren't contracting in a synchronized manner, they'll pull on things. They'll pull on your tailbone, pull on your hips, and kind of just make it uncomfortable. And so we've been doing that for over a year now. Have had some great results.
Yeah, tell me, what are the responses you're getting?
Oh, it's been wonderful. I even had some patients come to my last open house so that they could tell other women what a difference it had made. I've got one girl who does CrossFit who's like, I don't have to wear a pad anymore while I'm working out because I'm not leaking urine anymore.
Not worrying about that.
And a couple of some of my older patients have come in and said, I've started going out again with my friends to lunch because I know I don't have to be right next to the bathroom because I know I've got the strength to hold it. These are small things, but they are huge as far as quality of life goes. So I feel like we're making a difference with that chair. We're using it in our postpartum moms to re-strengthen that pelvic floor in between babies so that maybe at 65 we're not at that point where we need the chair for leakage because we've prevented it.
Or a visit with you in the surgical suite.
That also, yes. So we've been using that, and then piggybacking on that technology, we bought the M-Sculpt Neo machine, which is more for core muscles, really any muscle group. We've used it a ton on the core, on the abs. We've done some quads, we've done arms, we've done hamstrings, glutes. We can strengthen those muscles.
I think that's what I'm using right now. I've had a couple of visits now on some problematic back muscles.
So that's new. So when we first bought the machine,
tell me what I'm doing.
Yeah. So when we first bought the machine, same concept of electromagnetic pulses to strengthen and actually build new muscle. And it has some radio frequency, which heats fat cells to their death point. And so then your body flushes those out. So originally the technology was more body sculpting, right? Trying to strengthen some places, reduce the fat.
Get rid of handles and
Yep,
stuff.
exactly. Love handles, muffin tops, whatever you want to call them. But the company went through and created a functional set where the frequency of the pulses is different. The intensity is quite different. And the goal with the functional element is to return function. So for back pain, for any type of kind of acute muscle injury on a joint, we've had some really fun stories come out of that. A family member of mine had plantar fasciitis, and so we attached one of the smaller paddles to the bottom of his foot
Really?
and to the calf to release it because it was so tight.
Mm-hmm.
And he was able, within about 3 days, to be pain-free, which was huge because sometimes,
Oh,
that can go on for
people
weeks.
suffer with
Right.
plantar fasciitis.
So that was really cool to see it in action on
Wow.
somebody, personally for me. And then I had a little high school athlete who really had a good chance at going to state in her track competition or field competition, but she was having a lot of knee pain. It was preventing her from, doing as well as she normally would do.
So had she had that diagnosed? What the knee
No,
pain was from?
she just
Not
had some
ACL
pain.
or
It was
don't know.
tight. It hurt. Her parents are coaches, and so we knew it wasn't
Oh.
anything that she
That
needed surgery for.
scoping
But
or
it
all
was
that.
just really limiting what she felt like was her full capabilities.
Uh-huh.
And so we brought her in and treated the knee and then the quad and the calf to kind of release and let those tendons relax and let everything just relax. And she made it past district, made it past area, made it to regionals, and now she's going to state. And
Oh,
we've
my
treated
goodness.
her right before each competition to
Yeah.
try and make sure that she had that full range of motion. So that's been really neat to see that functional component. It uses a lot less heat and a lot less force with the contractions
Mhm.
to try and kind of vibrate those muscles into more relaxed. And so we're using it with the back pain, trying to relax those muscles. We've done some sciatic work as well on the glutes. I'm just excited about it. I'm all about helping with quality of life.
Well, yes. I mean, your motto, I guess, live long, live well, live better.
Mm-hmm.
And if you're hurting,
Yep.
or you're always wondering, am I going to be embarrassed?
Right.
Because
Can I do
of an
this
issue,
anymore? Yeah, exactly.
Yeah, I know. We know. You are my daughter, so she knows. But so that's why it's kind of exciting to see these new technologies because
They're
there's
non-invasive.
some aspects of medicine
Yeah.
you think, I just don't know that they're making a lot of inroads over the
Right.
years. But this is really a fascinating.
Well, and we
change.
have people that we're not running to the operating room anymore, which I'm glad, right? Like we
Right.
don't necessarily go, how can you fix this surgically?
Uh-huh.
There's more of a what can we do besides surgery, which I'm a big fan of. And so I love being able to offer non-invasive treatments that have no downtime. So regardless of which one of these we're doing, you're not down. You come in at lunch, you sit on the chair for 28 minutes, you go back to work. You come in with your back hurting, unable to sit at your desk, we treat you for 30 minutes, and maybe you go back and you can sit in your chair and be comfortable again. But certainly over several treatment sessions, we can get to that point.
Okay, well, and you think of the women, and of course, particularly mommies who've had one or two kids or more, things in time
Mm-hmm.
loosen up.
Yep.
But for the men, let's
Yes.
talk a little bit about the gentleman. I talked to a gentleman who did try the chair,
Mm-hmm.
and he was kind of like, is this snake oil? Is this, what is the deal?
Right.
But on his testimony, and he hadn't thought about it, but he realized he was sleeping all night. He
Mhm.
wasn't getting up in the middle of the night to go to the bathroom.
Yep.
So it had done something for him.
Yes, they have several studies for men specifically post prostatectomy. So there's a lot of men as they age that end up having their prostate removed, and it messes with all those pelvic floor muscles, all that innervation. And so in the studies, those men were able to have a decrease in any need for absorbent pads or things like that because they were dribbling. So that's one thing that I think is very important. And then and the particular guy that you're talking to is probably 40, 45, kind of in that
Yeah, if
range.
that, yeah.
So young, but I know even my husband gets up at night to go to the bathroom. And when you can strengthen that pelvic floor and help that blood flow to all those areas down there, you're not going to get that feeling of pressure. You're not going to have that awakening where you're like, oh, I've got to go. My bladder's full. I can't go back to sleep until I do this.
Yeah,
So you're
yeah.
getting better quality of sleep and then you're better focused and better functional with good sleep.
Yeah, everything is better when you can sleep.
Yes.
That is for sure. Well, it was funny. Went back and saw a little bit of things that we had talked about before, a year ago. Some of it was on basic things like weight loss,
Mm-hmm.
and just as a physician dealing with primarily, obviously, women because that's your practice.
Right.
I've heard it said, weight loss is one of the best things you can do for yourself.
Oh, absolutely. My husband and I were talking about it, and we decided that all of these semaglutide, GLP-1s, these new injections, Ozempic, Wegovy, this kind of stuff, it's been this kind of huge social experiment of like, is it better to exercise? Is it better to cut your calories in order to lose weight? And I think we're seeing overwhelmingly that cutting calories eventually is going to lead to weight loss, which just the decreased inflammation throughout your body when you lose 20, 30, 50 pounds is tremendous. We're seeing benefits mentally. We're seeing benefits in joint pain. Just anything that you can think about inflammation affects. And so if we can decrease that, we're going to have people who are living well, living better, living long. And so I think that weight loss is very important. We haven't incorporated any of that into our clinic yet, but we're thinking about it because it makes such a huge difference.
Yeah, and some way to help, in that department is always good. I spoke with an orthopedic surgeon who does a lot of knees. He kind of focuses on knees, and he always tells his patients, you need to lose 10 pounds before going to surgery, just no matter what, because the amount of pressure on your joints from that added weight. Well, he had a patient who went whole hog and lost 20 pounds and came in and said, Doc, my knees don't hurt anymore. So he said, good.
Yeah. Let's be done there. Yeah.
Let's not do this.
No, it's
so
true.
That's how important that is.
It's very true. And, for women, I think more women than men, but I think it also affects men a whole lot as we hit that menopausal point and the hormones are changing, and men hit a different point and their hormones change. I think maintenance, I'll say maintenance, because we all tend to put on a little bit when we hit that point.
Well, it's it's kind of like 10 pounds a year, no matter what.
Yeah. And so I think as we understand better what hormone therapy has to offer, I think that's going to be a very big deal coming up. I think we're starting to see that with some of the physician leaders who are pushing, the benefits of hormone therapy, where for the last 25 years we've said, oh no, that's terrible, nobody should be on it. Now that's changing.
I've never really done that too much because of the heart impact, right?
Well, yes, there was a large study that came out in 2001 that brought into question whether or not any women should ever be on hormones. And, menopausal women are out there going, we can't even work because we're hot flashing and we're not sleeping.
I've had some friends go, I would not have survived without it.
Yeah, a foggy brain, like I don't know who I am anymore. And so I think for 25 years, medicine kind of put that on the shelf. And now we've got a generation of women coming up to their menopausal years who are going, yeah, no, I'm not going to do that. And so we're bringing that out. We're doing more research, and we're seeing some of the longer term benefits that we didn't know about before. And I think I could do a whole show on that one because it's just really interesting and it's really encouraging.
Yeah. So bottom line, you do recommend.
I personally will take it forever.
Now, okay. As meaning as in pills, as opposed to like creams.
Hormone replacement therapy just means you are replacing your hormones. So that's not specific. It could be testosterone, it could be estrogen, it could be progesterone. There are multiple hormones that we replace.
Okay, and what about these? I've heard about some places that do these tests that really analyze your, blood work and all that kind of stuff.
Yeah.
Because it can be different amounts of things that you're, is that an important thing to do?
It depends on the woman. So if I have a person come in who's postmenopausal, she hadn't had a period in a year, she's for sure through menopause, I don't see a real big reason to check her hormones at the onset because I know they're all low. Like by definition,
you're not going to have much.
They're low. And so I don't feel the need to charge her money to check her hormones for them to tell me what I already know. Now, if she chooses after a discussion on, here's what the benefits of each of these are, what are you struggling with, what are your goals, okay, this is what I want to try, then as I begin to replace them, I will test them several times to make sure that we have an overshot or undershot, like that we're getting her what she needs, but not more than what she needs. And I think that's what I see a lot in some of the clinics is that I've had a woman come in with her hormone levels that were the equivalent of a first trimester pregnant patient.
Oh my.
Well, that's not replacement, right? Like that's overshot.
That's not, that was not fun.
Right, exactly.
That's like throwing up every morning.
Right. And then we've had testosterone levels come in 3 and 4 times their normal level, which is not what you're shooting for.
No.
So there is a role for lab work, but it's not necessarily that first one for everybody. And there are different situations. And then you asked about how to get them into your body. Those are also specific to the hormone. And for estrogen, for instance, is better absorbed through the skin. It has better benefits that way. Progesterone tends to do better orally because it's a large molecule. It's harder to absorb it. And then testosterone is better to absorb through the skin or through an injection as well. So each hormone kind of has a little bit of a different role, a little best way to get it in. It's a little bit more complex than just here's your HRT pill.
Yeah, really, really. I have not. There's a lot about that I have not understood, but you're a proponent of that
I am for many women, not everyone.
But for quality of life, kind of.
I think long term, I think we're going to see that for sure.
Yeah.
The grinder mentality that Randy and Brent Habert built into 44 Pro runs deep within our team. Every member shares a passion for the craft, the game, and most importantly, the player. When you step onto the field with a 44 Pro custom glove, you'll feel the difference. It's not just a glove, it's a 44 Pro. Crafted with dedication, made for performance, and built to last. Get your custom glove today at 44pro.com and experience the 44 Pro difference. That's 44pro.com, 44 Pro. Are you ready to take control of your health? At 4U Health, we believe wellness and lab testing should be accessible, inclusive, and yes, fun. With our tech-powered at-home lab test, you save time and money while feeling your best. Say goodbye to long waits and office visits. Check your health on your own terms with 4U Health. Visit 4uhealth.com today and free yourself from traditional medicine. That's the number 4uhealth.com. At Angel Bliss, we believe every parent's journey is a beautiful adventure. Our mission is to make it joyful and stress-free with thoughtful, safe, and innovative products. Born from a love for family, we promise peace of mind for parents and comfort for babies. From playtime to bedtime, every Angel Bliss product is designed with care, reliability, and a style to nurture the special bond between parent and child. Angel Bliss, creating happy memories, one baby at a time. Visit us at angelbliss.us. Angel Bliss. BizChair.com, your one-stop shop for premium commercial furniture that blends quality with affordability. From ergonomic office chairs to durable restaurant seating, we cater to diverse industries including corporate, medical, hospitality, and education. With over 20 years of experience, we offer fast shipping, exceptional customer support, and furniture solutions that stand up to high-traffic environment. Elevate your space with BizChair's vast selection of stylish, reliable, and cost-effective furniture. Visit us today at BizChair.com to transform your business.
So let's back it up.
Okay.
Pre-menopause for women who are sexually active and, concerned about family planning and all that kind of thing. Let's talk a little bit about birth control.
Like birth control. So I think it's very interesting. Social media dictates so much of the cultural thoughts these days. So
for good or bad, I mean, that's
both, right?
It is,
yeah, it depends on what's going on. But I have a lot of young women coming in who don't want to be on hormones because they don't want anything, foreign in their system that could affect them long term. And I totally support that if that's what they want.
Yeah.
But I think there's a lot of misinformation on social media about hormonal birth control.
Birth control pills, yeah.
Right. And the one thing I would say in a short period of time is that there are so many options these days. I have multiple options that don't have hormones. I have options that are hormonal, but they don't go through your whole body, through your system. I have, of course, the traditional birth control pills, but I also have a lot of information on those that maybe it's not as bad as is being touted. We use them for a lot of different things, including contraception. There's a new birth control pill out that is a similar estrogen to what we make in our placentas when we're pregnant. So it's a very natural hormone. So there's so many options out there that I really encourage people to talk to their doctor about what their specific concerns are and don't write things off as a whole class just because.
Not going to do that.
Right, exactly. Because we want to work with patients and we want to find the right thing for them that's not going to cause them concern, but that it's going to treat the issues that they need to some help with.
Yeah. Well, again, another area that goes continued innovation and continued
I have a lot of patients too who, in this point in time, don't have health insurance. And so it's like, well, I can't afford any of that anyway. But there are programs for that. You know, there's people there, the drug companies themselves give discounts. And I've, know of programs at different grocery stores where you can get birth control for $5 a month. And
Really?
I mean, that's so much cheaper than an unwanted pregnancy, or an unplanned. I guess I should say unplanned. So I just think that there's so much out there that it's well worth having conversations with your doctors to figure out what's the best thing for you.
Yeah. Conversely, I would think a fun part of your job is bringing those little ones
Oh, love it.
into the world. And
Last night at midnight.
I was going to say you look bright eyed, and even but it is a 24/7 kind of because babies kind of come on their own.
Yeah, we did a C-section
timetable.
for twins yesterday morning
Oh, really?
at 9 o'clock or 10 o'clock, and then
that's got to be exciting.
Oh, it's
when
so fun.
You've got a multiple.
It's very
situation.
fun.
Do you see a lot of that? I mean,
no, I wouldn't say I see a lot. I see
Not-
some.
okay, as far as multiple.
I probably
parts.
have a set of twins 3 or 4 times a year.
Really? I'm kind of surprised. I was thinking it was much more common because of IVF and
It was
things.
for a while, and then I think the U.S. has changed its guidelines on how many embryos we put in and how we do those guidelines, because I think we saw a lot of multiples, and there's a lot of risk with those pregnancies.
Sure, yeah.
And so I think we've dialed it back and really tried to make that not quite so risky for those patients who are going in for their infertility treatments.
Yeah, I mean that is. You hear a lot too about our birth rate is continuing to decline. So when people come in and are struggling, to get pregnant.
To get pregnant. So one thing, of course, we see is that women are putting off childbearing later,
Well,
right?
right.
They're finishing
It's a
their education, they're
function
finding
of
the right
age,
person,
yeah.
right? Yeah, exactly. And so personally, I start talking to young ladies at about 33 about just the possibility of egg preservation or oocyte preservation. And I don't push it. I just say, hey, I need you to know that this is an option. If you haven't found Mr. Right yet, or it isn't the right time in your life, if you want to do this as a kind of an insurance measure, I have information. Let me know if you want it. Because we know that chromosome disorders increase with increasing maternal age.
Right.
So the younger the eggs that we're using, the less likelihood there is for those chromosomal problems.
Right.
So sometimes people will just kind of put a few eggs in the bank, just in case.
Yeah.
So I start talking about that. But then if I've got somebody who's come in and they've been trying, a lot of times education works. Like I can't tell you how many women have come in and said, we've been trying for 6 months, we're not pregnant, there's something wrong with us. And I'm like, well, let's talk about it. How often are we having sex? And what are we, let me take some history from you and from him and see what's going on. And sometimes we fix it. And then 2 months later, they're pregnant and they haven't really needed anything except just to be educated. I had one couple that came in and said, look, we're doing this every other day for the last 3 months and we're not pregnant. And so I started asking questions and I said, wait a minute, did you just say that you were on testosterone? And he said, yeah. I said, okay, so we need to look at this, but your sperm count may be 0. And he was like, what? And he had no idea that taking testosterone, because he'd been diagnosed with low T, that had really shut down the production. And
what?
so
That seems like it would be doing the opposite.
well, because you're giving it to your body's not having to make it. And so, so things like that where people are like, I'm doing what I think I'm supposed to do to be well, and yet it's kind of coming around and creating problems on the backside. So again, conversations, education, I think that's what a lot of it is about.
Yeah. I was just educated not too long ago with a new term, a snowflake baby.
Have I heard that one?
Do you know what?
I don't know that one. I know rainbow babies. What's a snowflake baby?
I think, best I can tell, it's a couple who cannot conceive, and it's a fertilized embryo.
Oh,
it's like
yes,
adopting.
It is. It's adopting an embryo.
It's adopting an embryo.
That's the coolest. I mean, I just think that is the most amazing gift. I have a lot of surrogates that I take care of. So mommies who are carrying a baby for someone who can't. But to me, both the surrogate pregnancy and an adopted embryo is just the most incredible gift someone could give to a couple who just desperately wants a baby.
And this child is just beautiful, and they are over the moon. But for
I love
age-wise?
it for the family who donated it, because now they've given purpose to an embryo that maybe they have 4 or 5 or 6 kids and they really don't need to have another one.
Right. And then the ethical,
Right.
what do you do?
And so for them, I love that option.
I was really kind of totally unaware of that whole
It's
dynamic.
really neat. Yeah, it's
Isn't that
really
neat?
neat. Well, and to see those deliveries, to be present in those deliveries, and just the sheer joy
Oh, it just
of those families that have adopted those babies and now get to have a family of their own that mom has carried.
she's
and
carrying. I mean, it's
yeah,
her baby.
it's
I mean,
her baby. Yeah, it's really neat to watch. I do. I love
awesome?
that part of my job.
That just really is so wonderful. Everything you do, and appreciate you so much for this. Well, so what else is on your mind? I mean, what else can we talk about? I mean,
I just would tell people, we have so many options for information for our health these days, right?
Yeah.
We're very empowered,
well,
which I love.
and some of it may be good. Some of it
That's
may be
exactly
suspect.
exactly. That would be my point is, when you have a problem or you have a concern or you're talking to your friends, you're like, hey, that sounds great. Let me look into that. Go look into it, write down some questions, go talk to your doctor about it, because there may be options you don't know about that would be even more appropriate for you, whether it be treatment for a medical condition, birth control, how you're going to handle this pregnancy, getting pregnant, like all these pieces. But like, write it down, come in with the questions, have a conversation. There's so much information out there now. It's hard to know it all. And so much of it can just change your life for the better if you just bring it up. Bring it up to your doctor, bring it up to the providers that you're seeing, and so we can help make a difference.
Yeah. Well, it's wonderful the way you focus on the person, their overall wellness. I know is a spiritual component to that.
Oh,
too,
absolutely.
is important.
I feel like God has called me to this job. And so I knew that when I was a junior in high school. And so to me, ways that I pick up that I think will benefit my patient, or techniques, or, just options for them, because everybody's journey is different. And so what might work perfectly for one person is not an appropriate choice for another. And so getting to know my patients as individuals and being able to talk to them about what's going on and what's going to work for them is really important. And really why I opened my practice, Complete Women's Care, because we get so busy in the larger practices that we lose that time, and that's important to me. So I really love that part of it. And then again, that spiritual component of just being present at those births and just trying to do the best job that I can for what I've been called to do.
Yeah. Well, you have a lot to offer there. The laser hair removal, we haven't talked about that.
Yes.
I mean, that could be a big issue.
I actually bought that for a medical reason.
Did you really?
I did. There are women two groups come to mind immediately. There are women who have a problem, and men too, actually, where the hair follicle itself gets repeatedly infected.
Oh.
And it's very painful. It can be disfiguring, like it can tear up the skin under the arm, in the groin.
Yeah.
Requires a lot of antibiotics, which breeds antibiotic resistance. So
Right.
there's an issue there that I really wanted to have an option for, that was a long-term treatment, and not a just, well, we'll just wait till you get infected again, or here you've got to take this medicine every day to prevent it. Maybe we just do away with the hair follicle, right?
Yeah, right.
So that was one group. And then patients that have PCOS, or polycystic ovarian syndrome, have a problem with hair growth in places they don't want hair.
Really?
And it can be embarrassing, or it can be, it's just part of that particular syndrome. And so if we can offer that option to make them feel better and live better, that's what we brought it on board for. Now, we do a ton of bikinis, right? Like, we do a ton of underarms and a ton of bikinis. It's just convenience. But the reason we brought it in was for those medical benefits that we really want to be able to offer to patients.
Yeah. How painful is that?
It always depends on your machine. And a lot of times it feels like a little rubber band, like a little pop from a rubber band, maybe a little bit lighter than that.
Mm-hmm.
And so a lot of times when we have one, we have a cooler that we blow the cold air on top of a gel, so that you almost get that kind of cool sensation rather than the heat from the laser. So I would say I've had it done. It wasn't that bad.
It wasn't that bad. Okay. All right. Then the Emcella. Again,
Emcella is our chair.
It's the chair
for incontinence and
space
pelvic
age,
floor. Space age captain seat.
Start captain seat.
Even with the glowing blue lights.
Yeah.
And then we've got the M-Sculpt Neo, and that's for either body sculpting, getting started in the gym, finishing up things that you want to tweak that you've been working on, or in its functional capacity for joint pain, muscle pain, anything that we can use that electromagnetic
Yeah, I'm
frequency and
working on
heat.
it. I'm working on
To
it,
work
so,
on
yeah.
that, and then laser hair removal, and then just our GYN office as well.
Right. And so you have packages available, I guess.
Oh
for
yes, we are always running
everything.
specials, but we also I love it when we can get a patient in to talk about it first, because sometimes they come in thinking they want one thing, but then as we're talking about it, I'm like, I don't know that that's what you need to work on. I think part of this pain may be related to pelvic pain. I don't think you need the M-Sculpt. I really think we need to try the Emcella. So having those free consultations is really helpful, because then we can really identify the problem. But we often run packages like for our postpartum mommies, we do a core to floor where we're going to do abs, we're going to do pelvic floor for a discounted rate and things like that. And we try and put them on Facebook and
which is
Instagram.
wonderful. I mean, that's to get that toning back when you consider, a 8-pound baby. A lot of things get moved
A
around.
lot of things get moved around, and some of them don't come back together very well.
not as well as you would hope.
Right.
Well, it's always delightful to talk with you, Dr. Manning, and I appreciate so much what you do in the community, and how you're helping impact families all
Hopefully.
across Central
what we're
Texas. You have a
trying.
fabulous staff there.
Oh my gosh, I
And,
love
yeah.
the girls at my office.
They're wonderful and just
They're my
so
family.
much fun. And so I mean it's
Come see us.
it's good. I have been. So again, I appreciate what you're doing. And so
Thank
how can
you.
folks get in touch? I know you have a Facebook page.
We do. So the two different offices are within the same office space. So we have Complete Women's Care, which is cwcwaco.com.
Yeah, Dr. Haskett also.
And Dr.
with you.
Haskett's there. He's Waco Gynecology, right? This is all in that one space. And he does a ton of hormone
Right.
therapy. So that's been really beneficial. But we do, so it's just cwcwaco.com. And then it has a wellness tab that identifies all of our devices and what we use them for. And then we are on Facebook as Complete Women's Care and Complete Wellness Care of Waco.
Yeah, so you can find out all that information
Exactly.
for yourself.
Yeah.
So thank you again.
Thanks
I
for
know you've had a
having
long
me.
night delivering babies and doing surgeries and just all that. So I appreciate you
Day in the life.
carving out some time for us here.
It's been fun. I always like coming to talk. Again, clearly I like to talk and I like education. So this is a good opportunity
This
for me.
is good.
I appreciate it.
Thank you, and thank you. And we'll be back next time. Bye-bye.
Central Texas Life with Ann Harder is part of the Rogue Media family. Be sure to check out our other shows at roguemedianetwork.com. Please rate this show 5 stars on iTunes, Spotify, YouTube, or anywhere you get your podcasts. Join us again soon for more Central Texas Life with Ann Harder. This has been a Rogue Media Network production.